Yeah, so I have wanted to be a doctor as long as I can remember, and if you talk to my mother, she'll tell you stories about how when I was 4 or 5, I was obsessed with the human body. I think in 3rd grade, I asked for dead animals for Christmas for dissections. Yeah, so I've been obsessed with medicine, with the human body for a really long time, and I tried other things along the way. I went through an archaeologist phase, but ultimately I wound up deciding that going to medical school was what I wanted to do. And then in terms of cancer, I remember being at medical school during one of our noon lunchtime lectures, and there were medical oncologists from the community who came to give talks over that time, and they basically just really inspired me because not only were they practicing a wide variety of internal medicine, everything was a little bit more complicated. They were dealing with really, really sick patients, and you had the extra variables of chemotherapy thrown into the mix, and most importantly, it was just like the patient relationships that they had, the people they followed for years who had been cured from their cancer. And, that finally resonated with me as really something that I wanted to do. Then I got into fellowship, figured out that, even though the oncology seemed great and, you had all these benefits and the relationships, we still didn't help a lot of people. And I think that really fostered my interest in research during my fellowship. And so one thing led to another, and I find myself now kind of doing a little bit of everything. So I see patients, I run clinical trials, and then now I find myself also running a laboratory where we really focus on that bench to bedside transition, real translational medicine, and it's just been incredibly rewarding and exciting. Right, so I think the biggest challenge that I've faced and that I honestly don't think I've overcome is really balance. I decided fairly late in my career that I wanted to have a laboratory, and I think I swore at least 3 times I would never set foot in a lab again after doing my requisite rotations and my research experiences, but I really decided after I had the opportunity to run this clinical trial looking at immunotherapy in sarcoma patients that I really wanted to take it one step further. I wanted to understand why was treatment working or not working, and after having seen some patients have these incredible responses, I sort of became obsessed with figuring out how to make immunotherapy work for all patients with sarcomas. And so to do that, I needed to pretty much change jobs. I wound up coming out here to have the opportunity to work with real immunologists, as which I was not. I did not have a PhD, but yet I wanted to actually be able to run my own lab and, design experiments and hire people to mentor in science in the laboratory. And so I think, especially over the last years that I've been here, being able to balance between patient care and then clinical trials and some of my leadership responsibilities at the Cancer Center, and then being able to think creatively in the laboratory and really, carry forward what we're seeing in trials into RNA sequencing and all of these things that we're spending time doing. I think the hardest thing was learning how to balance. So while I say I probably haven't really overcome the balance issue, I've found ways to serve as an outlet to try to make myself feel better about that process. The most important lesson that I've learned is really about keeping an open mind and trying not to set out with too many preconceived notions about what your journey is going to look like or where you're going to be. It's sort of like you can close a door temporarily, but don't lock it and throw away the key, because one example is really just my journey back to the laboratory. After having not ever seen myself in a lab, it turns out that if I could go back in time, I really would have paid more attention during those lab rotations to some of those more novel techniques, or taken some additional classes in some of these things that I'm using now every day. We don't really know. So whenever you're coming into oncology, especially because the field is changing so rapidly, I think keeping that open mind and really, being open to explore different things, even if they don't immediately seem like a strength or something that you would previously be passionate about. There's something to be said for being aware of the coincidences, right? Like, you never ignore a coincidence, and or if something keeps coming up when you're having conversations, or you meet someone in a meeting and suddenly there's a collaboration that you never would have seen yourself potentially participating in, or being something that would make sense. Like, that's where so many of the exciting things that I've been able to take part in, they came out of coincidences or the random patient who walks into your clinic. So I actually had a sort of a second career in high school, and then in undergraduate I actually play piano, classically trained, and in my undergrad I actually majored in music and did a bunch of competitions in high school, so I love playing piano. So I try to exercise that other part of my brain, since at one point, as I was applying to med school, I had to decide that music was going to be the hobby and medicine was going to be the career, the main passion. But I do love sort of turning off the medicine side of my brain and being able to play from time to time. And then the other thing that I absolutely have fallen in love with since moving to Colorado is really, of course, the mountains and getting out and hiking. I did several hikes earlier this year in the early spring when the snow was still not completely melted, and I just remember having those moments where I'm like, yes, this is truly peace. This is where I really have the ability to kind of unplug from everything else that goes on in the day-to-day. Every single day, I think I'm reminded of the impacts that we make. And yes, there's good days, there's tough days, there's days where nothing in the lab is working, there's days where you feel like you'll never catch up with everything that's on the plate. But I had a lot of my patients when I left Miami were pretty devastated, and of course they Facebook friended me, or one of the most awesome things is now, years after I treated them, I'll get the updates on Facebook as to what they're doing and that they're doing well, and they'll call me out and say, oh, we're so grateful, or whatnot. But I just think, when patients are able to, despite all of the stress that comes with a diagnosis of cancer and all of the sacrifices that come with taking part in a clinical trial, for example, to see them be able to return to their normal lives is so incredibly rewarding. And there's one patient who I met a few years ago here who had a disease called angiosarcoma, which is incredibly rare, and he'd already gone through 3 or 4 different chemotherapy regimens, and it just kept coming back and coming back. But he was able to get on one of our immunotherapy clinical trials and ultimately wound up having a complete response. And he's now 2 years out from finishing that trial. And the other day I got photos from his wife taking pictures of him hiking the Grand Canyon, which is just sort of incredible because of what, how much he had gone through not that long ago, but now being able to get back out and live his best life. So, those are the stories that I could tell you about all day that just remind me, like, this really matters. And yes, we may not be able to cure everybody, but if we try to cure everybody, we can provide those incredible gifts, and that being able to get back to normal life for these patients, which is what all of this is really about. And as a leader, your job is to not just walk your own walk. Your job is to help others with different perspectives, different backgrounds, different opinions, to be able to get to the same goal, get to the same destination. And I've realized, like, we have blind spots. We have things that we think are really strengths about ourselves that maybe are not strengths when it comes to certain situations. And we may think we know the person sitting across from us very well, but in truth, we don't know. And so I think the biggest thing is to ask questions and to be open. And if you're in a situation where maybe you're not sure how to move forward, talking to as many people and getting as many different perspectives as possible, I really think is critical to being a successful leader. And that's sort of something that I've personally been working on. And I think it's when you're in such a complex system as being in a cancer center, especially now, you look at all of the pressures that are coming from outside that we have absolutely no control over, right? So living through COVID pandemic, the current crisis, with politics and the NCI and all of the uncertainty that comes with that, I think, we may have our own reactions, but as a leader, it's your responsibility to make sure that you're in touch with all of the people's feelings and priorities, so that you make sure that you're representing them as best you can. The thing I often will bring up is that actually I was homeschooled as a kid. I am the oldest of 3 kids. My sister is 2.5 years younger than me, and my brother's 7 years younger than me. So my mother did homeschooling for all 3 of us up until high school. So my early formative years were really spent, still with social interactions to some degree, but not in sort of the typical pressures of a public school or even a private school. Being homeschooled allowed me to be able to delve into projects and interests with a little more flexibility. And so I think that's in some ways allowed me to be able to be a bit more creative and not be too scared of taking on some crazy new challenge that maybe I might not have encountered before. Because if you can go to high school for the first time, your first day of school, and not totally lose it, then I like to think that I was pretty well set up to take on other challenges.